Hi everyone, in this session I am going to explain about the severe sepsis coding guidelines. So in the previous session we have seen the sepsis guidelines of chapter 1, right? So now I am going to continue the severe sepsis coding guidelines of the chapter 1, that is certain infectious and parasitic diseases. So what we have learned in the previous session, what is sepsis and how to code the sepsis, right? So whenever the patient is having sepsis with the underlying infection, so we have to code the combination code, that is sepsis due to whatever the organism, and if the casual organism is not documented, so we have to code the unspecified organism sepsis, that is A41.9. so this sepsis will leads to severe sepsis. So what is the severe sepsis and what are the coding guidelines of the severe sepsis, and also we'll see one scenario in this session. And this severe sepsis will leads to septic shock, and this septic shock session I will explain in the next session. Okay, now we will see the severe sepsis. So what is severe sepsis? Severe sepsis is the second stage of the sepsis. So first stage is sepsis, second stage is sepsis, severe sepsis, third stage is septic shock. So here you can see. So severe sepsis is nothing but the patient will have the sepsis, and also along with the sepsis patient will have the organ dysfunction also. That means it occurs when the sepsis is affecting the function of an organ, like it affects the liver, lung, like that it affects the function of the organ. So a patient who is having severe sepsis will have sepsis, along with that patient will also have the organ dysfunction also. So it develops, that means the organ failure will develops in the severe sepsis. So coming to the coding guidelines of the severe sepsis, so it requires minimum of 2 codes. So in the sepsis only one code, that is a sepsis with the underlying infection. So whereas here severe sepsis we need 2 codes, minimum of 2 codes, max of 3 codes. So first code we have to code the underlying systemic infection, that is sepsis with whatever the infection is. So sepsis due to staphylococcus, like that whatever the infection is there, so we have to code that one. So if we don't know the underlying systemic infection, we have to code the unspecified organism sepsis A41.9. So along with this we have to code the severe sepsis ICD also, that is R65.20. So along with the underlying systemic infection we have to code the severe sepsis code also. So what is the severe sepsis code? R65.20. So these 2 codes we have to assign whenever a patient is having severe sepsis. So sepsis with the underlying infection, and along with that severe sepsis, and along with this organ dysfunction also we have to code, like respiratory failure, like this any organ dysfunction will be there, like right? So liver failure, like that if anything is there, so we have to code that also along with these 2 codes, that is the underlying infection code, severe sepsis code, and also the organ dysfunction also. So minimum 2 codes, max of 3 codes. So like this we have to assign the ICDs for a patient who is having severe sepsis. So now we will see one scenario to have an idea. Patient is admitted with breathing problem, and the patient age is 90 years old. So physician has examined the patient, and the patient is diagnosed with the acute hypoxic respiratory failure due to the severe sepsis. So here the patient is having severe sepsis with the organ failure. So organ failure, what is the organ failure here? Respiratory failure. So what are the ICDs we have to assign, and the guideline applies here, that is the severe sepsis guideline. So in that scenario, patient is having severe sepsis, right? So along with that, respiratory failure is also there. It's nothing but the organ dysfunction, right? So what all the codes we have to assign? First we have to assign the underlying systemic infection code, that is A41 series. So do we have the systemic infection organism? No, right, in the scenario. So what we have to code as per the guideline, whenever the casual organism is not documented, only severe sepsis is documented. Sepsis because of what the organism is not documented, right? So we have to code A41.9, that is sepsis unspecified organism. So the principal diagnosis should be A41.9. And then next what we have to code? Severe sepsis code as per the guideline. So we have assigned this one. So if we know the casual organism like this, we have to code this one. If we don't know, so we have to code A41.9. So this is the principal diagnosis. Now we'll see the secondary diagnosis, that is a severe sepsis code we have to code. So severe sepsis ICD is what? R65.20. R65.20. So for your reference, we'll also see in the software also R65.20. So this is a severe sepsis code. See, you can see R65.20 is a severe sepsis. Okay, this is the ICD. And along with that, what patient is having? Respiratory failure. That's nothing but the organ failure. So we'll search for this ICD also. Acute hypoxic respiratory failure. See here, you can see this is the ICD. Acute respiratory failure with hypoxia. So this is the ICD for that. Patient with respiratory failure with hypoxia. So in this we have with hypoxia and hypercapnia. So we have with hypoxia. So this is the acute respiratory failure classification, and again it is subdivided like this. So what is the condition reported in that scenario? This is the ICD. Acute respiratory failure with hypoxia, ICD is J96.01. So J96.01. So like this we have to give the respiratory failure, that is the organ failure also. So whenever patient is having severe sepsis with organ failure, so we have to assign three ICDs. One is the sepsis due to the casual organism, whatever it is. So if we are not having that, so we have to code the unspecified organism sepsis A41.9. If any combination there is a casual organism is there, so we have to assign that appropriate ICD. And then we have to code the severe sepsis ICD, that is R65.20, and along with that we have to code the organ failure ICD also. So in this scenario we are having the respiratory failure, so I am coding that one. So like this appropriate ICDs we have to code. So minimum 2 codes, max of 3 codes if organ failure is documented, so we have to code that also. So for sepsis we have to assign only one ICD, that is the sepsis with the underlying systemic infection code. In the severe sepsis we have to assign two ICDs, that is the underlying systemic infection along with that severe sepsis, minimum 2 codes, max of 3 codes. So this is the sepsis and the severe sepsis coding guidelines. So what we have learned? What is severe sepsis? Severe sepsis is nothing but the sepsis which affects the function of the organ. So it requires three codes, minimum of 2 codes. So this is all about the severe sepsis and sepsis. So in the next session we will see about the septic shock. If you have any queries, please comment below, and if you like the video, please like, share and subscribe to my channel. Thank you.